So welcome everybody. This is Doug McCall from the International School Health Network. Welcome to this ongoing series of fresh partner open web meetings, and in particular the series of sessions on what we've been doing on the theme of monitoring, reporting, evaluating, and improving policies and programs. So this is our third session in that series, and the purpose of this session is to look at how we can evaluate and analyze various policy and program surveys, as well as various guidance and curriculum document studies that have been done. So we're going to be looking at two large-scale studies in Europe and in the United States, as well as looking at the study that we're about to launch with Simon Fraser University, UNICEF, and UNESCO, in terms of looking at a survey and a document analysis plan. The links are on the screen now, so you'll be able to follow up with them, but they are also posted in the Fresh Partners website, fresh-partners.org, to be able to follow the links that are showing on your screen. I'm not sure how we advance the screen here. There we go. And before beginning, a couple of apologies from people who I had hoped to, in fact, we were going to have with us today. Annette Schultz, who is the executive director of the Schools for Health in Europe, unfortunately has been working through a health problem and was not able to join us today. She's getting better each day, but she was not able to join us. And Holly Hunt from the Centers for Disease Control is also was called away to a meeting, and so those two participants who I hoped were going to be adding a lot are going to be having to perhaps do this through email and subsequent conversations. And I've just had a little alert that my internet connection is not stable, so I'm hoping that we're going to continue. Please jump in if I'm not being heard very well. The screen on the slide on the screen right now is looking at how we've organized the discussion today, and the rest of the slides sort of go through the items underlined and bolded. So looking at the three studies as well as other studies that are looking at different parts of school health promotion and social development, and these are the ways I'm suggesting we organize the conversation today. But if anything is not there that you think is very important to think about in analyzing and further investigating from these kinds of studies, please jump in and make sure that the idea is recorded here, and we'll follow up. I'm also going to the document that I've shared with you. Hopefully you'll see it in the chat box. Is a document that we're working on, which is a little more detailed set of notes than is possible to show in the slides, and you can read that at your leisure, and we'll eventually post it on the Fresh Partners website as a tool as well. First, maybe opening up a bit, any general comments about the studies that are going to be talked about today, or other studies, other reports that you're working on that we should be aware of as we move forward. And I'll just stop here and ask for any comments or suggestions for looking elsewhere, or any ideas about the process of evaluating and analyzing these kinds of studies. So you were saying earlier about the lots going on, and that's certainly true.
Yeah, I was impressed by what I've seen. Not only the number of studies, but the quality has improved so much over the past decade, without question.
And Emily or Parvez, do you want to talk a little bit about the work that's ongoing with the UN agencies partnership? Emily, I know they're working on a different kind of a format of reporting out of looking at studies related to school health and nutrition, and with the idea of having a report coming soon, I believe. Emily, do you want to comment on that as we begin?
Yes, but I need to Hello, everyone. I think you can hear me.
Yes.
Yes. Hello. Sorry for that. Yes, we have shared previously the plan to do the first global report on school health and nutrition. So the focus is really on school health and nutrition, but looking at it from a whole school intersectoral approach. So very much in line with some of the discussions we've been having in this group. We are not collecting primary data. What we are doing is reviewing the existing data that is collected, published, analyzed by other organizations or institutions, mostly UN agencies, but it can also be from regional networks, for instance, looking at the data that is being collected and analyzed, and compiling and synthesizing in a coherent narrative this information. And the objective is not only to have a first mapping of global efforts regarding school health and nutrition and really understanding what policies are in place and to what extent countries are implementing them, but also to be able to understand the data collected and what would be the recommendations moving forward in terms of monitoring and tracking of results and possibly defining indicators to measure progress. Right now, the first phase of this project is being carried out with the Partnership for Child Development, and we are doing with them a first compilation, mapping and compilation of the data available. And the drafting of the report will be done early next year with a aim of publishing towards the second half of 2022. Happy to answer any questions or give more details if needed.
Great, thank you, Emily. Parvis, Parvis has been working on monitoring and reporting in general. Do you have any general comments, Parvis, about the idea of, as per our previous sessions, we've been trying to move from the phases of monitoring and reporting to trying to look at analysis and eventually making sure that the data is connected to systematic improvements. And I don't know, Parvis, do you have any introductory comments on that that you might want to make? I'll open up the opportunity here.
Well, I think it's, can you hear me well?
Yes, yeah.
Great. So I think it's just an information sharing. You may know that WHO and together with partners have been revising their surveillance tool called Global School Health Policies and Practices Survey has been finalized, and you also know that UNESCO together with WHO worked on making all schools health promoting, and it has been agreed among partners and also between the two agencies that the Global School Health Policies and Practices surveys could be used as one of the instruments to monitor and collect data on the implementation of health promoting schools initiatives, especially in the early adopter countries. So you might want to be interested that this process has been finalized, and now there are discussions among the partners, UN agency partners, on how to make the tool digital and make it accessible to countries that are participating in the initiative. At the same time, I think it would be interesting for partners to know that in addition to that, so this tool has been finalized, and in addition to that, there is a new initiative that is funded by the Botnar Foundation. WHO will be taking the lead in terms of coordination and implementation of this project, and UNESCO will be partnering with WHO to collect data on adolescent health in 4 countries. The pilot project whereby the two tools, the GSHIPS, the Global School Health Policy and Practice Survey, as well as the GSHS, the Students-Based Health Behavior Survey, will be piloted, the revised version will be piloted, and the data collected in those two via this two tools will be used to inform the evidence base in those 4 pilot countries. So it's a relatively new initiative where we're going to have a chance to pilot test the revised tools, but also improve the evidence-based planning and using the data collected via these tools. So just information sharing.
Okay,
Over.
that's great. That's great. And thank you for updating it. As Lloyd said at the beginning, that there's a lot going on, and it's good to kind of, that's what my hope for these sessions is, that we take a broad lens and we're able to capture a lot of things going on, so we're more aware of them as we all do our work in different specific things. Maybe just to start to walk into the list on the screen right now, the scope of the investigation is already come up, and also the unit of analysis of action. In this discussion for today, we focus more on ministries rather than schools. Very often the emphasis in school health promotion and social development has been on the schools and not on necessarily on ministries or administrative units under ministries, but it's something that needs to be thought about. And then also the scope of the investigation, whether we're doing school health and nutrition, or we're looking more broadly at inclusion and equity and so on. And so hopefully the items in bold and underlined text will be relevant as we move forward. I'm just going to go to the next slide and talk about that, which is the scope and unit of analysis. And this is not focused on the school level, as I just said. In Europe, their survey was based on responses from, I think it was 24 of their 39 countries, school health coordinators. And so they were looking at school health promotion, which is their mandate, Schools for Health in Europe. But I was pleased to see that one of the values in the school health framework that they use, and they do have pillars and values, so inclusion is one of those. That's one of the things I highlighted. And then another area that was interesting for me as I looked at it was how health promoting schools policy was reflected in other ministry policies. And so it was discussed quite several times within that report. And so it's a way of looking at things more broadly. In a similar fashion in the US, there are a couple of reports from the Child Trends Organization, sponsored by the Kaiser Permanente Foundation, which is, I think, Lloyd, help me if I'm wrong, a bit of a newer player on the scene in school health in the US. The CDC has been doing a number of school health versions of the School Health and Policies Program survey or practices survey that has been for a number of years, and the Child Trends report is relatively reporting. There's both a federal report and state level reports that we're going to talk about today, but they're a relatively new player. And interestingly, as well, the US has, in the last few years, has broadened their framework to a whole child, whole school, whole community model, which is broader than health, at least in some ways, and includes the idea of social health. And so the second point in under the USA column there lists the questions that study, those two studies that reported on. What agencies at the federal level involved? How do those federal programs support the model used in the US? And how do they support disadvantaged groups? In the study just being launched by Simon Fraser, ISHN, UNICEF, and UNESCO, the scope is a bit different. It's our overarching idea is inclusion and equity, which is very similar to the language used in the UN goal, number 4. But we are also looking at school food and nutrition, as an important example of what we call a multi-intervention program. Lots of work being done on school food and nutrition around the world by several UN agencies, and we want to be able to report on that. And then health and life skills education is part of that conversation, because it's an area within the target 4.7.1 of the UN goals, which we see as an urgent focus, but is not being tracked in the same way that other aspects of child development are being tracked. I want also maybe to underline the a couple of years back, the FRESH partners looked at the FRESH framework a bit, and the acronym Focus Resources on Effective School Health. We played with that a bit to reinterpret that acronym, but also to take into account the notion of the whole child, which is looking at if a child is healthy, safe, challenged, engaged, and so on. And we use that, I guess, a stepping stone to be able to broaden our approach to look at not only health promoting schools, but safe schools, child-friendly schools, excuse me, and several other school frameworks that are in use. And we actually, in the study, there's 20 different global frameworks that look at the broad social role of schools that are actively sponsored by different UN agencies. And so we took a different view of that. And in the last column there, in terms of the two important studies which are cited in the document that I posted in the meeting, the UNESCO GEM report of 2020 looked carefully at policy on inclusion. It was a policy-focused study, but it was a very important point to look at how different studies focus on different things. And then WHO has a big study on maternal, child, and adolescent health, and looked at aspects of maternal, child, and adolescent health. But their focus, as proper for a healthcare look at that population look, it was really a much detailed focus on different aspects of health rather than just school health promotion and development. So maybe talk there and stop here and look at scope and analysis, unit of analysis. Question is whether or not it's important to shift towards more of a ministry level conversation rather than just at the school level, which has been the traditional focus. And then also looking at, can we broaden this out from a capital H health to a health and social health, as the American study has done, or looking at the values that the European study has done. Maybe a little discussion around that about the scope and context, and whether that's appropriate for getting a broader picture of what's going on across the world on all aspects of child and youth development. Any comments or suggestions about that? Okay, I'm going to go to the next slide, which is...
May I ask a question?
Sure, go ahead.
Comment? It's really helpful to see this overview of what's currently occurring. Could you help me understand, if not others, where the effort, the 2014 and 2015 publications by FRESH on monitoring evaluation guidance, the standards and the appendices, the framework that they developed, can you kind of help us understand how that fits into these other efforts?
Yeah, it's going to the sort of the last item on the slides, which is really kind of using a systems approach. The share partners, the FRESH partners have developed a couple of what we call cross-cutting themes. And one of them, monitoring, reporting, evaluating, and improving, it puts together the activities that are suggested by that title. And so we're trying to look at better practices in monitoring, better practices in reporting, and so on, and the important linkages to, does it end up in improvements in systems or improvements in policies and programs. And so we've been having a conversation and we'll continue the conversation about different better practices in that. In a similar way, we developed as part of that cross-cutting themes, a set of ideas around implementing, maintaining, scaling up, and sustaining. And again, as everyone would likely know, there's been a lot of work about I think they're based in Australia. There's an implementation center and a center of excellence based on implementation in Australia, which has been helping us learn a lot about how to best implement, how best to maintain, how best to scale up, and more importantly, I guess, how best to sustain. So the MREI theme is an attempt to improve practices in this area. And of course, policy and program surveys are one device of doing it. A couple of sessions ago, we looked at how accreditation of schools as healthy schools or other kinds of schools, that's a strategy for maintaining quality. That's another idea that's been used. That's a strategy used in countries like Taiwan and Singapore and in Hong Kong. Some of those are not countries, but not necessarily countries. And so that's another device in that conversation. So Lloyd, I don't know if I've answered that enough to.
Yeah, that's helpful.
Yeah.
That's helpful. Thank you.
Okay. So maybe to go to the next slide, if I can get this screen to move. Sorry, I don't know what I've done here. This is not helpful. I think I'm going to stop sharing and come back up again, see if that gets it back into focus. Is everybody seeing a set of slides, both the small tabs as well as the screen? And I'm just going to go. That's the one we were just looking at, unit of analysis. I think I'm going to stay in this format because the other one seems to have frozen. And now showing a slide. I'll just. Oh, there. No, I don't want to do that. Okay, sorry for the technical problems. Are we, yeah, okay. Are you, hopefully everybody's seeing a slide called status and use of MCAs and MIPs?
Yes.
Okay, good, thank you. Sorry for the technical problem, I'm not sure. I guess it's a rookie on the Zoom meetings, even though I've been doing a lot of them. This is a slide that's trying to capture what multi-component approaches like health promoting schools or child-friendly schools are, or what multi-intervention programs such as school food and nutrition or safe or school mental health or several others. What we're looking at here is trying to see how those different MCAs and MIPs are being examined. And the text at the top of the screen is maybe a bit of a divergence. There are some folks who are using an expanded version of their traditional framework or MCA, such as health promoting schools, which is a way of incorporating more and more issues into that. Or there's another way of approaching it, which would have several MCAs sponsored by several sectors, and then using that as the way of organizing the information. Both are legitimate. Europe and the US have used the studies that we're looking at here, have expanded the notion of healthy schools. The study that we're engaged in, along with others, is using several MCAs that are being sponsored by different UN agencies. That was our criteria, that had to be in use by UN agencies. So if that's helpful as a way of introducing this topic, and I think, and maybe just I'll introduce the idea of it. There is a sense in the field that it's a very crowded landscape, and all these different frameworks or programs or approaches compete with one another as they go into schools. And in my view, at least, I think it's important that we help countries make decisions about how they want to do this work and what kind of conceptual framework they want to use, whether it's an expansion of one framework that is widely used and only used, or whether it's recognition that in most countries, several frameworks will be actually in use, and maybe it's better to recognize that and to work with that. So maybe to stop here and think about that and ask for any comments about that notion. No comments or suggestions? Okay, in Europe, they make a distinction, and this is another aspect of the same problem, I think. Their report, their overall report, emphasizes the distinction between doing school health promotion based on individual programs, such as on drugs or sexual health or AIDS or nutrition or whatever, and the actual use of a multi-component approach, such as health promoting schools. The responses from school health coordinators in that study that over 75% of the countries do individual programs, but less than 25% of the countries are using a coordinated health promoting schools framework. And that's kind of an interesting, I think, an important finding. In the US study, it was noted as being a bit of a surprise in the webinar that I attended. The study that was done by Child Trends found that the Department of Justice was equally, in fact, more involved in school-based programs than Health and Human Services. Those two were the bigger players, but of course, in the federal scene, there were several departments doing programs, but they all had different perspectives and mandates and priorities. And the coordination of those many different interventions, I think, is a real challenge for us. And having a conceptual framework of several MCAs or an expanded MCA is an important choice to be made by countries. And it probably depends by countries as to whether the competition among the multi-component approaches is really ongoing, or whether there's more competition among different types of programs, nutrition, drugs, and so on, bullying, et cetera, et cetera. That's probably an important piece. I'll maybe stop there and say, is that a legitimate problem that we need to think about whether whether this is a real issue for policy and program improvement? Any comments on that? Okay, maybe I'll just keep going and jump right in whenever you have a comment or a question. Sorry, go ahead. Yeah.
Doug, just perhaps, I'm sorry because I joined the call a few minutes late. But what I'm understanding is that you are sharing the overall approach to the study that will be conducted. I'm not sure what kind of feedback you're looking, if it's on the approach or whether the assumption or the statement reflect a shared concern among sides. I'm not clear what type of feedback actually you. I'm sorry for saying
no,
that.
Thank you.
That's good. A little bit later, so
yeah, no, thank you. That's helpful.
Not sure how to best contribute.
And what I'm hoping to come out of this conversation is as we evaluate and analyze the various studies and be they policy program surveys or reports or document analysis, what are the issues we're going to face as we move from just the data towards analysis and then eventually program improvement and so in this issue of taking this particular issue, the frameworks we use or the expansion of one framework that we use is a big important choice about how we organize the findings from the various reports and how we're going to be plugging it back into the systems that are operating with either one expanded MCA or several MCAs. And so what's the best way to analyze and evaluate the data that leads us to more chances for improvements of systems and approaches and programs. So that's kind of the challenge. It's a relatively new, I think, a new question for us. Basically looking at how we use data to move towards improvement, and how we organize the data is a very important piece, I think. So that's kind of the task for the discussion. Hopefully that's clear.
Well, if I could respond then based on that to your last question, and at the risk of, I hope not being pedantic or being obvious in the remark, but the function of measurement actually has in the past and can in the future define what it is that we would hope that nations or states, provinces actually do. So if we're measuring and suggesting that multi-component approaches that are integrated rather than separated are desirable and can offer scientific data to confirm that, then that helps for making progress and moving towards those component approaches. So just the fact that you've just stated that only 25% are implementing in Europe, if I understood you correctly, kind of coordinated programs. And if that's kind of identified as something that we want to move past and have more coordinated programs, that's an intervention by itself. So that would be my kind of policy read on
it. Thank you. That yes, and that sort of takes the what we measure matters, right? But I'm also suggesting, and one step beyond that is what we've chosen to measure is a function of what we've chosen, how we've chosen to organize our work. And so we've organized it in various multi-component approaches, which often compete. And of course, there are subsets within those multi-component approaches on specific program areas like nutrition and drugs and bullying and so on. And they're also competing. And yet, at the end of the day, we're hoping that for greater intersectoral cooperation from a number of different ministries and agencies. And so if we don't, and so I'm suggesting through this slide that how we organize our investigations will matter in terms of how the data is attended to or ignored. And so that's kind of the point of this slide is whether we're really taking an intersectoral approach or whether we're really trying to expand a sectoral approach within one sector such as health or safety or environmental or whatever. And there are variations, the two different strategies of expanding and being more inclusive in an MCA or recognizing there are multiple MCAs is an important point. Another aspect, and it's reflected in the European report, again, it asked if the health promoting schools policy is embedded within several ministries. And the response obviously was it's mostly in the Ministry of Health and Ministry of Education, but there was a little bit of coverage in some of the other ministries. I'm just going to stay with the European report for a moment on the slide. As indicated, a minority of countries do require a coordinated approach in terms of policy requirement that the that the interventions need to be coordinated, but most did not. And then the other part, and it's again a part of the same discussion, is we've often used the term entry point into schools. And the strategy has been to take a hot button issue, bullying or trauma or whatever, these are the latest ones, or mental health is another one, and use it as a way of getting into schools to gain the attention of educators, which is a good practical and strategic strategy, but it ends up being that you're trying to build a momentum around a single issue rather than around an intersectoral approach, or around a framework. And I think the evidence suggests that they are indeed still siloed in many different ways as they go into schools. And I think the American report is indicative of that in terms of the distance between the idealistic coordination in the whole school, whole child, whole community framework, and so on. And then of the study that we're engaged in with UNICEF is asking about different barriers. It starts with the notion of barriers to inclusion and positions the multi-component approaches and multi-intervention programs as addressing those barriers to the broader goal of inclusion and equity. And then asks more specific questions. Is there an inter-ministry mechanism to coordinate the various approaches and programs? And to what extent are they working? And then although to almost in contradiction of what I've just said, school nutrition has been a very traditional sustaining interest of educators. And so it's seen both in the US and European studies and in the study that we're engaged in, that it's an important stable piece. And so knowing what's going on around school nutrition and health is important. So again, it's trying to look at how we're treating the multi-component approaches and multi-intervention programs. And maybe stop and again ask for comments, or have we got this idea at least posited as a question for further analysis? I'm going to say that, take that silence as a yes. The next slide looks at the status and use of the core components, and as we will all know, the policy component, the instructional or the educational component, student services component, the physical environment and the social environment, there's a lot of agreement around having a set of core components. In the US, they have 12 components. A lot of countries have 3. Europe has its own model, and we've used 5 in the ISHN UNICEF study as a way of organizing the information. So that's sort of a beginning point. I'm going to skip through that and look more at the next slide, which is beginning to look at one of the components, which is policy and priorities. And maybe to go back to a point I wanted to make earlier, in the study we're doing with UNICEF, we're asking not only is there a policy, but whether or not there is whether there's a statement, whether people have endorsed it, a consensus statement or a declaration, such as a framework such as child-friendly schools or health-promoting schools or school health. There's lots of those out there. There's 20 of them out there. Or whether there is a policy requiring coordination. And another question might be a policy requirement of addressing the disadvantaged within the policy as being a priority. Those are policy requirements or requirements that need to be defined in policies. And another area we're asking about is whether there's an action plan for a certain number, either on a yearly basis or a multiple set of years in which the policy is being implemented. So So that's kind of an important piece around policy. One question that we asked, we tried to extract from the 3 studies is whether or not the countries have identified some specific issues or components that are deemed to be priorities and are written to be priorities. And you can see the responses in Europe. 21 of the 24 countries responding, or coordinators responding, reported 9 specific health issues. It was really a topic or issue-based approach. Page 42 of that full report, the coordinators reported that they do not have a set of priority issues. In the US, the physical health topics, nutrition, physical activity, hygiene, were addressed and implemented well in lots of different ways, primarily through the Health and Human Services, but they were often being addressed in isolation from other federal programs that were looking more at the social development side or safety side of child development. And so there was real isolation among the policies. And then in the notes about the study with UNICEF and ourselves, we've asked directly whether or not the jurisdiction has a set of defined interministry priorities for its work in schools, which is consistent with the FRESH, the first part of the old FRESH acronym, which is to focus resources on specific programs. And then another area that has contributed to the narrowing of a focus is to look at research evidence showing that this or that program is effective. And because there's not research done on a lot of different programs, it leads to a narrowing of focus around some evidence-based programs, which are then reinforced by more evidence and more study and more development. And again, it leads to a narrowing of the work. Maybe again to stop there and ask for comments. Is that a fair treatment of the policy and priorities issues? Is that's helpful in terms of helping us understand to best evaluate and analyze these kinds of studies? Okay, I'm going to go to the next one. And this one may be more developed because there's a lot more work that's been done on health and life skills education. And you can scan through the information that's there. You can see in Europe, 16 of the 24 countries do require some sort of health education. In 14 of those 24 countries, health instruction is in 2 different types of curriculum structures. And 9 of the 24 have a standalone health education curriculum, and so on. You can see the notions there. A lot of minority of countries have tried to promote health in a cross-curriculum competency framework. 19 have promoted teaching of health in several subject areas. And this is a new area that health promotion and health education activities are included in extended education, but they're required only in 4 of the 24 countries and recommended in 12 of the 24 countries. In other words, the extended education would be at extracurricular, co-curricular, online activities, working with parents in home instruction and so on. All those kinds of extended education activities is a relatively undeveloped area. And you can see the set of questions that the American study asked and the set of questions that the ISHN UNICEF study is asking. And you can see similarities there, but also some challenges. Maybe over on the final column where I brought out a few more of the other studies that are in the list that you will find in the document that I posted. Maybe start with the UNESCO. UNESCO has done a survey. It's an expansion of the survey that UNESCO does for several years since 1974. It has been adapted to capture goal target 4.7.1 activities. But unfortunately, health and well-being have been largely left out of that process. And so we're hoping that we can bring that back into the discussion in future years. You can read through, the OECD has done a really interesting study about social emotional learning, and the UN Agency on Disaster Risk Reduction has done a really interesting study about how that has been infiltrated in curriculum, across the curriculum in several countries. I think it's 30 different countries. Maybe just stop and take a moment to see how these data points contribute to a health and life skills education piece or analysis. Are these does this data lead to, how can this data lead to improvements in health and life skills education? And what's some of the implications of the findings from these studies? Maybe stop there and again ask for comments. Okay.
Dr. Malcolm?
Sure, Emily, go ahead.
I was wondering if one question of interest, and perhaps it's covered elsewhere in your survey, but perhaps one point of interest would be teachers training and teacher support to provide education. And perhaps more easy to assess than the supply and demand for education specialists. Just a thought, but certainly something that in our studies has come out as a very important element to sustain education activity.
Yeah, that's true. And the studies that have been done around teacher development for teaching health and life skills education have been focused more on their readiness to teach health and life skills education. Our study is looking more at whether or not there's been a systematic approach. And if you're taking a systematic approach, then you need to look at what is the supply of teachers and what is the demand for them. And that we suspect that the answer is it's not going to be a supply and demand issue that has been well studied. That question in 35 has also looks at whether or not elementary teachers have been prepared specifically for, primary school teachers have been prepared specifically for health and life skills education, and so on. There's a variety of different categories of teachers that need to be considered in a real comprehensive, systematic approach to workforce development. And so again, our systems systems analysis approach has asked questions like that. But most people have been asked, most studies have looked at whether or not the teachers are trained, whether they're qualified, whether the number of years of experience they have in teaching health and life skills education, all very important data, and has been reported out in several studies. If you look at some of the other issues around this, an important question in my mind, at least, is whether or not the analysis of health and life skills education has been focused more on coverage of topics, or whether it's on whether or not there is a generic set of standards, standard skills, essential knowledge, and critical values or attitudes that are being promoted in the programs. In what most of the stuff that we saw as we prepared our study was that they were more focused on the coverage of topics rather than some other things. You can see the questions in the ISHN UNICEF study. It's also, we're trying to look at structural issues in terms of what is the best curriculum structure, whether it's health education alone, personal and social development alone, health and life skills together, health and physical education together. what's the structure, what's the instructional time available, and so on. Whether there's a purposeful and comprehensive use of extended educational activities, or whether it's done on an ad hoc basis. So those are the kinds of issues that we're hoping to have some data on. Maybe over in the final column there is some confusion in my estimation about the terms. We've used health and life skills education. Social emotional learning is an overlapping term. Some organizations like UNICEF have life skills, but they really define it as a set of transferable skills that go into any curriculum area, whereas the European models of health education often look at skills for living, which is relationships and family skills and interpersonal skills, which are more living skills than life skills. So that this is an area for further work, and Lloyd, you probably know more about this than others than we do. There is a work being done in the U.S. to take a look back at take a look again at the health education standards in the U.S. and trying to update them to incorporate some of this new thinking that's going on. I don't know, Lloyd, if you wanted to add a bit about that.
Well, as always, you bring up central issues. To say what my take, and it's only one person's opinion, but my take of what's going on in the US is that in the US, there's long been a focus of training teachers in physical education and health. It's often called health and physical education, but the primary training is in physical education with secondary training in health. So that what happens is that employers, schools in the US will almost always hire someone trained in physical education and health because they can teach then physical education, they can coach a sport, and they can teach health. Those folks are usually, in my opinion, not trained as well as people that are trained only in health education. So there's debate and some division in the US about whether to address that problem, because the majority, again, in my opinion, we don't have good data on this, but the majority of people are trained in physical education and health, not in health education at secondary level. So it's an interesting political conundrum. And again, it just shows how monitoring and evaluation can really help articulate what the issues are. And it extends beyond the schools, because what has been occurring, again, in my opinion, in the US, is there's been a remarkable reduction in the number of PhD granting institutions that train people in school health or in school health education. And usually they do both. So the kind of research and focus and training for people that can teach health and life skills and teach others to teach that has really declined. So it's, again, these issues all kind of help articulate that. Like it's really helpful to see these, especially cross-cultural, cross-nation analysis.
Okay, I just managed to change slides here. I'm gonna try again I'm jammed up again. Maybe just staying with this, the health education, health and life skills education for a moment. This is a normal area of investigation for us, and because a lot of the attention in school health promotion and social development has been on what the teachers do, then we focus in on this area. So, and yet at the same time, as we began our work in the fresh working group on health literacy and health literacy, life skills, and social inclusion, I was a bit, well, no, I was not surprised, but it was kind of disconcerting when I realized that we had no idea how much time was actually being planned or how much time was actually being delivered in health education. The first study that I saw that twigged my interest in health education was out of the US, where it found that 50 hours of health instruction had some behavioral impacts. But we have no idea whether or not students around the world are actually receiving that minimum kind of 50 hours. And we went on in the working group to look at, okay, what time is needed? And we found that we don't actually have really good definition of what's the minimal amount of learning that is required to have to get students to the threshold of planning to change their behaviors. We don't have any real evidence-based assessments of that. And then whether or not the scope and sequence of health education curricula is done by consensus by people in the field, or whether it's done on the basis of evidence about how much time is required. And then, of course, the coverage of topics is going to be varying across the different countries. So in other words, a whole lot of study about health education and life skills education that that we can, sorry, I'm just getting back to the slide I was on, that are hopefully captured in some of these questions. As you may recall, we do have a working group, international research network associated with the World Education Research Association that is trying to develop a really more coherent approach to this kind of issue of health and life skills education. Has done a number of papers, and I'm pleased to announce that we're going to be doing an in-face and virtual face-to-face and virtual meeting about this at the American Education Research Association conference in San Francisco in April. And hopefully by then we'll have a more coherent set of questions for the International Research Network within WERA that can take this and hopefully working with groups like that starting up in the US, that we can take a real deep dive into health and life skills education. I think I'm going to stop because I think this process was overly ambitious, and we're not going to be able to get through all the slides in order to do it the way this is going on. It's not working in terms of giving you a chance to really think about this and comment on it in a substantive way. So I'm just going to maybe ask for how we can best proceed. There is a document that we can circulate among Fresh Partners and wider that can crystallize some of the points that are indicated by asterisks in each slide, and maybe develop a set of ideas about how evaluation analysis of these kinds of studies can be improved, and try to develop a bit of a paper on that rather than working through this with the examples. It's my fault for trying to do too much in too little time, and not enabling you to have a chance to read through the materials that I didn't have time to do on my week off yet last week. So what we'll do is try to do this by email and by discussion paper. And I'll stop and ask if that's acceptable to you as a way of proceeding, because obviously we're not going to get through the content that I thought we were going to be able to skim today. Does that make more sense for folks? Again, silence is consent. So
sounds great.
Yeah,
sounds like a good idea.
Yeah, just way too much ground to cover in this. I'd really in the document that was posted, you'll have a list of references for all the different sources. So please do take advantage of that. And I will add the one that Parvis mentioned, and so that people can take a look at the more recent studies. Emily, you have your hand up if you wanted to make a comment.
First of all, thank you, Doc. That seems a reasonable way forward. Just perhaps to understand the next steps and how this fits in your entire project, perhaps you mentioned that at the beginning. When is the survey going to be implemented? Do you already have a timeline for the implementation of the survey? And my question related to that is, I could see you posted a revised survey ahead of the call online. Is this for feedback? Is this the final survey? Just to understand where you are in the process and whether you welcome inputs or if the survey is finalized now. Thank you.
We're field testing it, so any comments would be welcome. We're not able, I think, to really change the approach very much, but we are, if there's glitches about how we're asking or what we're asking about, we still look for feedback on that. But we are field testing it now with the idea of having it out, launched in the field in the next couple of weeks. So please do if you do have the time, please do send me comments that come out of that draft. Also I'm asking, we're going to be broadening our approach to who we're asking to respond to the survey. We realize this is a very comprehensive survey. And so we're going to be building up the number of people who could help the respondent. We're calling them correspondents that will be able to provide information to the respondent, eventually looking for one response per country or state or province. The document analysis and the help from the correspondents will be, I think, very helpful. We're realizing as well it's going to be a country by country process. We're not going to get huge responses from all the countries and states. It's a sample of 300 jurisdictions, and so we're probably going to be engaged with this for several months. And I was actually interested to see that even in Europe, which has a well-defined school health network, and well-defined coordinators in each of the jurisdictions, their response rate for the 39, I think there's 40 countries. We had 24 and 16 of this. It was 24 countries. So asking for a smaller survey. So we're going to have to be patient with countries and correspondents and respondents to be able to develop this picture. And one of the hopes that we're going to be offering to folks is that through the document analysis and through the questionnaire, through the survey, we'll be able to provide to countries a real profile of what's going on in their country, which they can then use for their own planning. And I think that's more and more important. Should always be the primary reason for asking countries to respond rather than just providing data to the global organization. If we can provide profiles based on the survey documents and based on the survey and the collection of documents, then in the long term, we're going to be able to provide a lot of help to the countries if they're ready to do some long-term planning. So if that's folks are comfortable, I'm just going to actually go down to the very last slide. For fresh partners and others online, there's two items which are fairly urgent and important. There is a draft educator statement that's being developed being led by Irma's group, the Deans of Education, Global Network of Deans of Education. And those educators represent teachers, psychologists, guidance counselors, school principals, school district administrators. And so that's a unique opportunity for, they're developing a statement on education reform generally, and all of the organizations in that little group are sympathetic to health and well-being issues, but it's more about a response to the upcoming UNESCO Futures of Education Commission. And then in a second point, I've been asked to be part of a small presentation to an upcoming UNESCO forum on transformative education. And as I indicated in the material I sent out, very pleased that health and well-being is being welcomed into a session that is also focused on global citizenship education and on education for sustainable development. That's a real opportunity, I think. And so we're going to be participating in that. So if you take the time to go click through that and find the links, I'd be very pleased to receive any suggestions about the points that could be made in that presentation. And Parvis and I, I'm hoping, Parvis, now that you're back at work, we'll be able to have a chance to prepare those remarks as part of that session. And the bullet points underneath that are some of the ideas that I thought we might want to be talking about. We don't have time to look at those today. Any comments about that? And I apologize for the overly ambitious approach today. I'll have to we'll rethink about how we use